name is Ганиева Шахзоda Шавkatовna. I am an associate professor of Pediatrics Department of Bukhara State Medical Institute. The topic of my lecture is bronchial asthma in children. Unfortunately, bronchial asthma is one of the most common chronic diseases in the world, and its prevalence is increasing, especially in children. Fortunately, asthma can be treated and controlled. Almost all patients can have no symptoms at night or during the day, prevent severe asthma attacks, and minimally or do not use relievers, medications that relieve symptoms, and live an active, productive life, have normal or near to normal lung function. Bronchial asthma is chronic inflammatory disease of the respiratory tract, which is characterized by variable reversible bronchial obstruction and hyperreactivity of bronchi. Their increased sensitivity to various irritating stimulations. It's characterized by periodic attacks of shortness of breath and, first of all, suffocation due to bronchospasm and hypersecretion of mucus and edema of the bronchial mucus. It's the main pathogenic mechanisms of bronchial asthma in children. Bronchoconstriction of asthma. Here you can see in this picture two sides of normal bronchial tube, which has relaxed smooth muscles and healthy alveoli, and tightened smooth muscles and swelling and mucus. Because in the second picture, in this picture, you can see the inflamed bronchial tube of an asthmatic child. Primary immune response is immunological mechanism includes the development of allergic hypersensitivity reactions of immediate and delayed types. There you can see in this picture that the main cell is mast cell, and which is productive histamine, and after this, viruses or some allergens can attack bronchus, and antigen-presenting cells produce some interleukins, like interleukin 33, 25, interleukin 13, 4, and 5 types. The immunological basis of allergic inflammation is the polarization of CD4 lymphocytes, T lymphocytes towards a subpopulation of Th2 cells. Secondary immune response is the second stage of pathogenic mechanism. Subsequently, immunoglobulin E antibodies are fixed on mast cells, then basophiles and eosinophils required by the cytokines into the respiratory tract. This is stage by stage histamine releasing, bronchospasm, then edema of bronchial mucus, increased bronchial secretions. After this, finally begin gases trapped in alveoli and reduced ventilation. Then begin some symptoms of bronchial asthma like coughing, shortness of breathing, and wheezing. Here is common asthma attack triggers. Triggers is the main etiological factors. First of all, air pollution. After this, tobacco smoke. In children, most of all, pets and mold, cleaning products, and pests. Internal factors may be genetic predisposition, because some children has their genetic predisposition by parents or by some relatives. After this, atopy and hyperreactivity of the airways, gender, race, and ethnicity. External factors are home allergens, house dust, animals allergens like cockroach allergens, mushrooms. External allergens may be pollen, secondhand smoke, active smoking, air pollutants, external pollutants, and indoor pollutants. Obesity, parasitic infection, socioeconomic status like number of family members, and diet and medications, they are the main external factors in children, because some of our scientists talking about hygiene hypothesis too, and the hygiene hypothesis has about 20% of external factors. Factors that provoke exacerbations and cause symptoms to persist. It's home and external allergens, indoor and outdoor air pollutants, respiratory infection, physical activity like some sports, and hyperventilation, changing weather condition. Most of all, the winter season is maybe like provoke exacerbations of bronchial asthma. Sulfur dioxide, food, nutritional supplements, medications, excessive emotional stress, smoking may be active or passive or sometimes secondhand smoking, and irritants like home sprays, paint, odors. And diagnostics. Diagnostic of bronchial asthma is not easy because for doctor, first of all, the main thing is clinical diagnosis, suffocation attacks. The second type is laboratory diagnostics, eosinophilia in the blood and nasal secretions, scarification tests like allergy probes, and immunoglobulin E, special immunoglobulin E immunogram, assessment of external respiration function like spirogram and peak flowmetry. Here is the allergy tests which we do on atopic type of bronchial asthma. Skin prick testing, you can see in this picture with common environmental allergens. First of all, simply rapid to perform and very inexpensive and has a high effectiveness. Serum-specific immunoglobulin E. Measurement of specific immunoglobulins is no more reliable than skin tests and it's more expensive, but may be preferred for uncooperative patients, thus with a widespread skin disease or if the history suggests a risk of anaphylaxis, because anaphylaxis is the main risk factor for decreasing the symptoms of bronchial asthma. Classification. Form of atopic infections and allergy mixed. Course of the disease may be intermittent and persistent. And stage 1 is intermittent bronchial asthma, stage 2 is light persistent, stage 3 is moderate, and stage 4 is severe persistent bronchial asthma. The period of disease may be the period of exacerbation and the period of remission. Complications of the disease: pulmonary heart, chronic emphysema of the lungs, pneumosclerosis, segmental or polysegmental atelectasis of the lungs, emphysema, spontaneous pneumothorax, asthmatic status, and neurological complications. Medications for the treatment are: first of all, the first stage is for emergency assistance. We use beta-2 short-acting agonists and anticholinergic medicines, then theophylline group drugs. For routine treatment, we call this basic therapy. We can use glucocorticosteroids, beta-2 agonists, mast cell membrane stabilizers, and inhaled corticosteroids. Sometimes we use oral glucocorticosteroids in tablets. Here is the levels of asthma control. There are 3 types of asthma control: controlled asthma, partly controlled, and uncontrolled. When we took the patient into controlled group, there must be none or 2 or less per week the asthma daytime of symptoms of asthma, like wheezing, shortness of breath, and etc. More than twice a week is partly controlled. And limitations of activities may be none in controlled asthma and some limitations in partly controlled. But in uncontrolled asthma, there are 3 or more features of partly controlled asthma and present in any week. And the exacerbation of asthma in controlled group is none. In partly controlled, 1 or more per year, but in uncontrolled asthma every week. And what is an asthma action plan? We can divide this in three groups: green zone, yellow zone, and red zone. Green zone is the first section, and the green zone means this child is having no symptoms. If child have no symptoms, it means that asthma is controlling. This medication must be taken every day and consistently to work. It is very slow acting asthma. Yellow zone is the next section, and the yellow zone means the child is having some symptoms of asthma. The rescue or quick relief medications to loosen the tight bands will be located in the yellow section. And red zone is the worst zone, very serious zone, because the red zone means this child has severe symptoms of asthma. If child needs the risk medication sooner than 4 hours, they need to see a doctor, because the red zone is a hospital treatment zone. And there are some myths and facts about asthma. First of all, the fact is that you can get asthma in any age. It is not only childhood disease. The second fact is asthma is not infectious disease, and it's not viral or microbial disease, because asthma is atopic and allergy disease, so that's why every time doctor must know which kind of etiological factors and which kind of triggers there in these children. And finally, when it's under control, people with asthma should exercise and should have some sports or some physical activities. Thank you for attention, and I want to say that because breathing is the greatest pleasure in life, we have to control asthma and help our children properly.